Welcome back to Part 3 lecture for ALH 4, Chapter 13. We left off where I was asking you to tell me to name all of these, as many as you can, and also you can tell me a couple of the tests that are used to assess hearing acuity. Email that to me and I will give you an electronic virtual ticket for class. So tuning fork testing, going back here. We've looked at the tuning fork in our book there. There's the tuning fork. It measures hearing by air conduction and bone conduction. To activate the fork, you hold it by the stem and strike the tine softly on the palm of the hand. The Weber test is used if a patient reports better hearing in one ear than another, and the Reedy test compares air conduction sound with bone conduction sound. In normal hearing, the sound is heard twice as long by air as by bone. It's important to note that in bone conduction, the sound vibrates through the cranial bone to the inner ear. Striking the tines too forcefully on the tuning fork forcefully creates a tone that is too loud for diagnostic use. So take note of both of those things. The audiometric testing, this measures the lowest intensity of sound an individual can hear. Wearing headphones, the patient is exposed to sounds and asked to signal when a sound is heard. If initial screening indicates hearing deficit, an audiologist may be consulted. And this is something that we did for our patients that starting at age 5, we would give this test as part of their physical examination, their annual. So it's important to note that the results are printed on a graph called an audiogram, or the medical assistant charts the results on a graph sheet. Typically now with EHR records, it will be included within the EHR and can be printed out. An adult with normal hearing can hear tone frequencies below 25 decibels, and children with normal hearing can hear those below 15 decibels. And here is your figure 1320 in the book. A and B show an audiometer here on the left and how to correctly place the headphones on the right. Routine examination instruments should be disinfected or sterilized after each use according to the office policy, and then they're stored in a clean area. Or sometimes you also have a place that you just keep them and clean them and store them all in that same hearing testing spot. You can find this in procedure 13.5, and 13.5 describes the protocols for measuring hearing acuity with an audiometer, as well as you can view the resource video on this procedure as well. I included it in your cue cards and resource video area. So treatment procedures for the ear. Ear irrigation done to remove excessive or impacted cerumen, to remove a foreign body, or to treat inflamed ear with an antiseptic solution. We administer irrigating solution with applicator, and it's tilted upward toward the top of the external canal. Always chart the treatment and its results immediately after its completion. With instilling otic medications ordered for ear installation is given to soften impacted cerumen, to relieve pain, or as an antibiotic drop for infectious pathogens. Patients with ear conditions may be in considerable pain and may have difficulty hearing, which makes the health teaching a challenge. So you need to be aware of both of those facts. Wait until after the procedure has been completed and the patient is more comfortable to reinforce the health behaviors. You will see these in your procedures 13.6, which outlines how to irrigate the patient's ear, as well as procedure 13.7, which provides the steps for instilling medication eardrops. Examination of the nose and throat. The nasal cavity is examined to test mucous membrane and nostrils, and the throat includes the larynx and the pharynx. Seen with a mirror, the tongue depressor, and sometimes they use a gauze square on the tongue depressor. You will be doing collections of throat specimens, but you will be doing that next semester in your lab procedures class. So we'll talk about it and what it looks like to assist with, but you'll really be doing them and checking off on throat cultures next semester. The physician may use a nasal speculum to visualize the nostrils and examine the nasal sinuses by palpation. And the physician may also spray the patient's throat with a topical antiseptic before the examination to prevent the gag reflex. Gag reflex is very common in collection of throat specimens, so you want to be prepared for that as well. We would typically kind of move our small trash can, or if a patient had a typical response of a gag reflex, we'd even have an emesis basin ready for them. And that way, if they did have the gag reflex and actually vomit, we would be prepared and it wouldn't make a huge mess. Procedure 13.8 describes how to collect a specimen for the throat culture. Again, you can take a look at that, but you'll actually be doing that during next semester's class. So with patient education, use good listening skills, appropriate nonverbal methods, and touch to communicate empathy and understanding. Include family members in the patient treatment plan if possible. And here again, we want to offer referrals to community resources if we're seeing like hearing loss or vision loss or any resources that we feel could help the patient. What are some modifications one can make to help the patient with sensory loss? So a person with a vision loss benefits from large print forms and handouts, increased levels of lighting, and verbal rather than written instructions to reinforce the learning. For an individual with a hearing deficit, printed instructions, demonstrations on how to manage treatment, or even sign language interpretation should be available to ensure that accurate teaching and communication is happening and achieved. Our legal and ethical issues here: make sure to attain the patient's signature on NPP form, and the NPP form developed by the facility that outlines the patient's rights and facility's legal responsibilities to safeguard the patient's protected health information. And public facilities must comply with the ADA requirements for physical accommodations. To prevent accidents and office injuries, always ask a sight or hearing impaired patient whether he or she requires assistance. It's important to remember that regardless of the patient's disability, the ambulatory care center must follow the guidelines for notice of privacy practices, the NPP, established by the HIPAA law, which is the Health Insurance Portability and Accountability Act. And we must follow this at all times in the ambulatory care setting. If you have any questions, please go to the question and answer board and put them up there, see if anybody can help you out. And I can also respond, as well as you can bring them to class. I hope you have a great week, and I'll see you in class. Bye-bye.